thank you so much for inviting me and presenting with the opportunity to tell you a little bit about the work that the Silent Witness Project does in New Brunswick and what I've learned as the researcher for that project, looking at the deaths of the women at the hands of their intimate partners. I've also been a family violence researcher and was on a family violence on the farm and in rural communities research team for 15 years. We also conducted a study on firearms victimization and abuse of pets and farm animals in a rural context. And I must say that one has to be very cautious extrapolating domestic homicide risk to domestic violence risk. But the parallels were so eerily similar, it made you shiver. But I'm just going to focus on the domestic homicide. In 2001, I was part of a group of representatives from a number of organizations that came together to start the Silent Witness Project in New Brunswick. And I said, well, I can contribute. I have a doctorate in the social science. I'll contribute the research. I'll pull the case files. I'll read the sentencing reports. I'll read the victim impact. I'll look, which in New Brunswick we considered a better practice. We did a lot of things. We were the first Silent Witness Project, so we did a lot of things that we then characterized as better practices because we were first and we thought they were great. We also, when I wrote on the shield what happened, 2 or 3 lines out of all of what you'd learn from the court files, we thought the family should have the opportunity to read what we had written and then add personal information. So there's been about 40 deaths since 1990. We started in 2001, went back to 1990 because that's when the Silent Witness Initiative started in the United States. Now I forget what I was going to say. Anyway, in those early years when we were starting to do the analysis and how did they die, what was the cause of death, was there previous history of family violence, and look at that. We do a lot of public presentations, but we would still use the national data from StatsCan, and we would still say things like, the majority of women are killed at or after separation. So for a number of years in 2001 said that until we had analyzed 20 and then 25 and then 30. And the clustering, I know that 40 isn't significantly, statistically significant, but when you have 40 deaths and 55% of them are with firearms and almost all of those are with hunting rifles and shotguns, the red flag has to go up. We have to sit up and take notice. And people said to me, well, maybe it's because you went back 20 years and that skewed the results. So I took the deaths from 1990 to 2000. 55% were with firearms. And then I took 2001 to 2011. 55% were with firearms. And all of those are with hunting rifles and shotguns, not handguns. Then I began to the national data would tend to say about 20%. So the 2008 domestic homicide death review in Ontario, it's about 20%. The deaths are with firearms, and most of them are stabbing. That's the most common. Well, not in New Brunswick. But then when I think of my own research on rural and firearms victimization, what we learned is that New Brunswick is a pretty small town rural. We have 785,000 population. Over 50% live in populations of less than 1,000. 70% of the women who were killed came from communities of less than 10,000. I look at the Ontario Death Review, and I think it was over 55% lived in populations of 500,000 to over 1 million. So the situation and the context for the women in New Brunswick is really quite different, and obviously the services, responses, policies, interventions have to reflect the lived reality of women in our province, and rural women generally experience abuse in a social and cultural context that's a little different than urban. So I began to look at some of the other factors and realized that a risk factor is a risk factor, but the way they clustered, the top 7 that clustered around the women in New Brunswick weren't the 7 that clustered around the victims in Ontario. So I sort of began to call the domestic homicide national statistics, I mean, I don't mean this disrespectfully, but I'd say an urban myth, because they were very urban-centric. They didn't really reflect. And that's not to minimize how important, how much I learned and how much we all learn and how they make a difference. But what can we find out from looking at the New Brunswick statistics? And it's not just to look at them to say, we have more firearms deaths. It's what can that do to help us prevent other deaths? So just to give you a few, because I had about 30 of them. So most of them were in small town, rural areas, as opposed to Ontario. 37% were killed at separation. And now that compares to 81% in Ontario were killed at or after separation. So what we say is, yes, separation is a really dangerous time, but in a province like New Brunswick, you've got 63% of the women, and sometimes it varies up to 70% because those numbers are so small, they're killed in intact relationships. So everything changes when you have, between 60 and 70% are killed in intact they're in the home, they're not stalked, they're sitting together, they had supper together, then they were watching TV, then they had a big argument, and they drank, and then he took out the rifle and didn't mean to shoot her. I was supposed to be shooting the picture of my son on the wall. Oops, accidentally shot her instead. So it wasn't surprising then when 70% were murder-suicides, which again relates to the firearms in the home. The firearms are there. Most of the murder-suicides are with firearms. So I just realized that if we're going to do public education and awareness, if we're going to think of strategies to help women, we possibly have to do something quite different. And there's so much I'd like to talk about. I will say 75% in the court cases and the murder-suicides where I was able to get information on alcohol, drug involvement, 75% involve serious drug or alcohol addictions or use, involvement of the crime, and over 70% of the men were said to have addictions. Now, that's really important because cases go to court, the ones that go to court, they all started off as first degree and second degree charges. Great number of them, like way over half, ended up as manslaughter, where there were 3 NCRs, but manslaughter, because the judge would say he was so drunk he didn't have the prerequisite to, plan this murder. It was manslaughter. It was a tragedy that resulted from the fact that these 2 people were drinking. Over and over and again, the judges even say it's a senseless act that was caused by drinking. So I'm saying in our public education, we have to find ways individuals have to be accountable for their personal addictions, but as a society, what are we doing? I see in New Brunswick in our family violence research, people minimizing, normalizing, making excuses for people who are drinking and abusing, hitting, taking out shotguns, doing all kinds of things, and they say, he only does that when he's drinking. And women would say, some of the women I looked at everything. I looked at obituaries, found interesting stuff in there. I looked at what they said, the family said to reporters. So the family would say, she was so afraid of him, he was always pulling out that gun and threatening her. But in the court case, there was no evidence of family violence in the same court case. But on the courthouse steps, they would say, so I would tick was there a history of family violence? If the family told a reporter on the courthouse steps there was, I said yes in my box. So I'm not doing academic research in the way that some of you do it. I'm just trying to find anything about the death that could give me some sense of what was the context, and is there something we could do to help others. So, one of the things that I did about 2 years ago was create a new tool. It's a safety planning. It's called Safety Planning for Women Living in Abusive Relationships, a strategic approach to increasing your safety. So it's quite different because a lot of the women in New Brunswick they're flying under the radar. They're not involved with police. They're not having interventions. They're not having risk assessments and danger assessments. Nobody knows about it till they're killed. I don't know if this is the best tool. I'm just developing it. I'm looking for partners. I'm looking for funders. I'm looking for, to set up an evaluation of it. But I do know that, yes, do no harm, but that doesn't mean do nothing. And I really think that for rural areas where the situation is different and the personal risk assessments in these have women asking questions around different sort of themes where the factors fall, around emotional response, around health. I was really quite amazed that about a third of these deaths, some of them I stumbled on the health problem inadvertently. They weren't in the court files, but when we went to the families and had them write, one of the families, she was beaten to death by her husband. They said, I want you to add 2 weeks after finishing radiation for throat cancer. Oh, she had throat cancer? That wasn't in any of the court documentation or the sentencing report. And then the next one had bone marrow cancer, and the next one had diabetes and had lost half her foot. And so I just sort of divided them into sort of themes that was caring for her to death, because the court would say often, he soldiered on and tried to care for her, and she just became such a burden, he snapped. So there was the caring for her to death ones, and then the scaring her to death, and then the blaming her to death, which was part of a loving her to death theme. So they're all integrated in here in a very, I think, unique way. And I'm really looking for some partners to help me get this tool created and tested and out there for women. And this would be for women in the sense of available through non-specialized service providers like healthcare providers. So you'd go to the doctor. I want to do a guide, do training for the service providers, and then have mental health, social services, doctors. They're in a position to say, would you like to do the safety planning tool? There's an interesting article. I just mentioned this, and I forget the name, but I could give it to you when I get back because I printed it. It's in my office. And it was on danger assessment and safety planning tools. It was done in the States, and it was about women who feel that these plans are foisted on them, and that often, in the end, they end up going back to the abuser, and they start to feel like failures at leaving. And then they're a little bit embarrassed to go back and get a third danger assessment or whatever. So that strategically, we like to be able to have women do some of their own self-assessment, even risks which we know are self-harming, walking on eggshells and things like that. They were part of their strategic plan. They were doing them for a reason. And so to identify the ones that they can and are able to start taking action to mitigate risk around some of those particular areas of risk in their own lives is what this is about. Thank you very much.